Governor Gary Herbert of Utah, we thank you for talking earlier today at American Enterprise Institute. You talked about Utah's approach to state-based, principled, market-based health policy reform. It has to be a little frustrating, though, dealing with the federal government. You've had those negotiations for some time, including recently. We'll talk in a larger context in a minute, but what do you sense from your dealings as to what the HHS, the Obama administration, federal government's definition is of state flexibility and partnership based upon what you've been trying to do and the type of response you've been getting?
Well, I guess the proof is in the pudding. We'll see what we actually get. They certainly have said to us that they would like to give us flexibility. We've been talking flexibility with the administration for a long time, particularly when it came to Medicaid and the ability we have to find innovative ways to deal with Medicaid. We've asked for 9 different waivers. We've got permission on 3 of them. We've been granted. But they all surround the idea of flexibility. Let us find better ways to do it. And sometimes we'll find great outcomes, and maybe sometimes we won't. But it's in the trying that we will learn from each other and maybe find better processes. So I'm hopeful that with our exchange aspects of the Affordable Care Act, which is the law of the land, whether we like it or not, that they'll grant us some flexibility so that we can continue to administer our state exchange how we think it should be done based on free market principles, but that yet remains to be seen.
Well, most recently you've been trying to find that safe space to continue your state-based exchange in a different manner. And what you're talking about is something you use the term bifurcation, where the federal government may end up taking over or does what it does with regard to a individual-based exchange, and you would continue on with what you've been doing, and assuming you could get that certified by the federal government for a business-oriented defined contribution exchange. It's a slow-growing market for any type of shop or business exchange. What's been the experience in Utah in building enough customers?
Well, there's a lot of things that come to mind, Tom. One, Utah has actually been in pretty good shape when it comes to health care. We have a very healthy population, historically been ranked as one of the healthiest states in America. We have the lowest cost for health care in America right now, and about the 5th or 6th highest rated quality. So our ratios are very good, and for us it's kind of, it ain't broke, don't fix it. That being said, though, we recognize the challenges of health care and the rising costs. And not only the rising costs of doctor's visits and hospital visits and those procedures, but the rising costs of premiums with insurance. And so we engaged in healthcare reform starting back in 2006. We were really on the cutting edge. We were way before the Affordable Care Act ever even came to be a thought in President Obama's mind. And so we've been out there, started our own exchange. We think it has great potential under free markets, competition and individual choice and defined contribution, which is a significant change as opposed to a defined benefit, to have great potential. But it will take some time to grow and see what happens and see what the market was willing to embrace. But it does provide a 4th alternative. Under the Affordable Care Act right now, states are given the choice of do your own state exchange, being compliant with the law. Some are reluctant to do that. You can default to the federal government, let the federal government set up the exchange, and they just do what they do, and you kind of just ignore them. Or the 3rd alternative has been a partnership. We'll join together and work together as partners, and in a 3rd way. Well, our model is a 4th way. We're saying in Utah we already have an exchange. We're going to continue to do the exchange with the business community. We're not going to change what we're doing. We're going to do it. And for those who want to have the individual exchange part, the federal government, you do that separate and aside. So again, we'll bifurcate responsibilities. We'll continue to do what we're doing and expand those opportunities with the business community. You take over the responsibility of the individual mandate.
You've been dealing with federal officials, and that's a difficult dance. As we know, all health politics is also local. How's this going over in the state of Utah? It seems like there are pretty strong views in the state legislature where they've got more than a 10-foot pole in terms of not wanting to get too close to the Affordable Care Act. That's a difficult balancing act because you have responsibilities to get something that works, but it sounds like there are folks who really don't want to get in very much of a partnership with the federal government based on the history of this law.
Well, that is a big difference with governors, because we actually do have to get things done, as opposed to Congress, which is talking about some of the same things today they did 10, 20 years ago and don't seem to ever get things done. But we have to get things done, and we have to work with our own legislators to get things done. And there's a lot of uncertainty. Uncertainty creates anxiety, and you wonder, what will the end result be? We can't predict it. Are they going to change the rules? Are there going to be modifications? What is going to be the increasing cost of health care with the Affordable Care Act? And that can be pretty dramatic, as we see from history. So there's clearly a lot of people that say, why don't we just punt this, get away from it? We don't want to deal with it, and why expend any political capital? The reason we want to do it is, one, we're already there. We already are up and running with an exchange, and we think it has great potential. And two, we also care about America outside of our own borders, and if we default to the federal government, is this just going to open up more the pathway to single payer and a federal control of the healthcare system, which I don't think we can afford. Number one, I think will probably decrease quality and increase costs. So states ought to stand up and at least take a real hard look about being maybe the last line of defense against an overreaching federal government when it comes to health care.
And the states have that role and their choice with how they want to deal with the exchange issue and the Medicaid expansions. Part of your talk today was to establish a little bit of a template or an example. What we did in Utah isn't exactly the same as will happen in your state, but maybe there's some things to think about as to how to approach this. How much of a common platform might be built among the states who are skeptical about the wisdom and the virtues of the Affordable Care Act? Is there a way in which you might be not just lighting a little light in a cave, but sending a message to other states that there are other ways in which they may want to think about doing something similar?
Well, I understand that other states are looking to see what our success is, and again, the fact that we're out front on this issue gives us kind of a leg up. But the idea of states controlling their health care for their own unique demographics, you know, Utah is different than other states. Everybody has their own uniqueness, but we're a very young state. In fact, we're the youngest in the nation. Our median age is only 29.2 years of age. If you contrast us with, say, like a Florida, where we have a lot more senior citizen population, you can certainly readily understand that the health care needs of those two demographics are different between Utah and Florida. So we probably ought to approach things a little bit differently. And the one-size-fits-all mentality that comes out of Washington, D.C., I think is really taking us down the wrong road. It will be more expensive. It will be less effective on this one-size-fits-all approach. So every state ought to be the laboratories of innovation. We talk about laboratories of democracy. It's laboratories of innovation where they can create opportunities and find solutions in their own unique ways for their own unique demographics. And we'll find success in many of them. We might find some failures, but we'll learn from each other. That's the beauty of the system. That's the beauty of federalism. We will learn from success and failure and gravitate and evolve to the right position for our own unique states.
Governor Herbert, your talk earlier today was maybe a mixture of optimism and pessimism, which is how most realists are. And we can paint a dark picture and we can say, oh, no, this will turn around. Where are you at the moment in terms of what you think is happening to health policy in the country? Maybe not just in the current moment, but what we have to look ahead toward.
Well, I'm cautiously optimistic with our bifurcation approach that it's, at least the concept is being received and being considered. And so I'm hopeful that we can find a resolution of that particular part for Utah of our own health care exchange. I'm very concerned about the direction the country is going when it comes to fiscal irresponsibility. I come from a state that's been very fiscally prudent. We're one of only 7 states that have a AAA bond rating from all the 3 rating agencies on Wall Street. And we don't spend more than we take in. We live within our budget. We live within our means. We don't have unnecessary debt. We save for a rainy day. We actually have a savings account, and that's what everybody should be doing. I'm concerned I don't see anything close to that happening in Washington, D.C., where we're borrowing 40 cents now out of every dollar we spend with no end in sight. $16.4 trillion in debt and adding over $1 trillion each and every year. I mean, it doesn't take long to do the math and say this is not sustainable. That's my big concern. It's like my dad told me when I bought my first automobile. You can buy it if you can afford it. And we're buying things we can't afford. And someday we're going to have to pay the piper, and I think it's going to be a rude awakening for us and could it be cataclysmic effects on the economy as we go forward with this next generation.
Governor Gary Herbert of Utah, thank you so much for chatting with us today.
Honored to be with you, Tom. Thank you.